I'm now going to show you IV insertion. I have knocked on my patient's door, introduced myself, washing my hands. I've explained what we are going to do. I will identify my patient. Can you tell me your name and your date of birth? Okay, and I'm verifying that against my order. Put some clean gloves on. I usually wear a medium-sized glove, but for IV insertion, I like to wear small because I want it pretty tight on my finger so I'm easily able to feel for those veins. I have all of my supplies here. So we have an IV start kit, a J-loop, an IV needle, and a flush. I'm going to open my start kit. I'm already looking at my patient's arm to decide what vein might be good to use. I've asked my patient if there's any reason I can't use a specific arm, and we're gonna go with his left arm here. I'll get my flush ready. So I've pulled this out of a sterile container and I'm going to not touch that end so it remains sterile. Getting all the air out there. Just flush that through so it's ready for you. And then we'll put it to the side. Everything I don't need, I'm just going to put over to the side here. I have my tourniquet. I like to stretch it out a little bit when I first open them. Go ahead and put that on his upper arm. You want it to be about 4 to 6 inches above where you are planning on injecting or putting your needle into your patient. You don't want it to be right on his elbow or his wrist, so be careful of those joints. I have a gauze pad ready for me. I'm going to put that right there. I also have a chucks or a towel underneath my patient because this can get a little bit messy, so you want to have something that is easy to take off. Let's turn him. All right, I'm going to go ahead and use this vein. You want to make sure that you can feel it. It feels a little bouncy. It's not hard. You're looking for a straight vein that doesn't have any valves or bumps and is wide enough to accommodate the needle that you have. We'll go ahead and clean the site up and down. I'm using alcohol. You might have something else in your kits. We'll let that dry. Make sure that your patient is comfortable with the tourniquet. And then you want to hold your needle with your 2 fingers, your thumb and your forefinger, so that nothing is underneath the needle. You're holding it up like this, pinching that. You want to make sure that the bevel is up. And then you can have your patient clamp and release their hand a few times to really pump up those veins, but make sure that their hand is loose before you put the needle in. Then go ahead and use your non-dominant thumb to pull down the skin taut, and going at about a 30-degree angle, you go straight in following the line of the vein until you get a little blood return right here. And then you want to drop the angle and push it up just a tiny bit. And then I like to stabilize my fingers here and use my thumb to push this forward. Some people like to use their finger. You'll figure out what works for you. Before I pull this needle out all the way, I put a little bit of gauze under here so that I don't have any leaking, and then remove the tourniquet. And you want to hold down so that your patient doesn't bleed all over the place. Go ahead and connect your flush. And make sure you're stabilizing this the whole time. You don't want to let it go, because if it flops to the side, it can bend the catheter. And then you go ahead and flush. It should flush easily. If you're having to push hard, you're not in the vein and you should pull it out and try again. So once I have verified that I'm in that vein, it flushed well, I'm going to dress it. Putting that tegaderm right over the site. Once you have your tegaderm on, I grab the tape, and you can do this part with or without your gloves. I like to rip this down so I have a small piece and use that to make a chevron. So you put the sticky side under and then cross it over. And then I'll use the bigger part to secure the tubing up here. I pinch it a little bit so that it's not pushing right on my patient's arm. But it's secured on there. Clamp this if you don't have any fluids running through it. And then I will label it with my initials, the time and the date that it was inserted. I will take off my gloves, wash my hands, clean up my area, document the location and the size of the IV gauge and how my patient tolerated it. And then we're done.